I want to talk about a case that we recently had at Mayo Clinic up in Jacksonville. So this was a 33-year-old gentleman who came to us. I've left intentionally blank this area of risk factors because this highlights the pathology that was ultimately implicated in this man's epilepsy, and I'm going to leave you hanging because I need everything I can do to keep you interested in this. He was ambidextrous, right-hand predominant. Interestingly enough, he had had the onset of seizures at a very young age, only 6 weeks of age. So neonate with the onset of seizures, they were described at that time as being in semiology with funny noises that became associated with eye movements and laughter. This went on for a number of years until the age of 7, where he had his first generalized convulsive seizure. Again, as described, these all started off as what we would call gelastic seizures or laughing seizures. They would occur every day. He also had other semiologies. He had jerking seizures that would occur on a weekly basis, as well as drop attacks that would occur up to daily. He underwent gamma knife surgery to this particular pathology about 7 years ago. So now he's 26 years of age, and he undergoes gamma knife surgery. I think this highlights the point made by a number of presenters this morning, Dr. Warren, Dr. Sheth, is that we go for many, many years in the pediatric population with various forms of management. However, we generally don't go to surgery right away. So this is a gentleman who lived for 26 years having daily seizures, underwent gamma knife surgery. As it turns out, that was not effective. It improved his jerking seizures. However, as you can see, he had a new onset aura that was described as a hot flash, followed by vocalizations, and these would occur daily again. The laughing seizures continued, the drop seizures continued. His treatment history, as we've kind of described this morning, was one marked by a variety of medication regimens. Current medication he was on when he presented to us was lamotrigine, levetiracetam, and phenobarbital. And of course, you can see from that list of past medications, he had been on a number of medication regimens, none of which had provided a therapeutic benefit to him or made him seizure-free. Non-medical treatments included, as mentioned, the gamma knife surgery as well as a vagal nerve stimulator. However, even after all this, he continues to have seizures. This is a video of the seizures that he was having when he was evaluated at Mayo Clinic. Perhaps one of the interesting points about this is that this is really one of many in terms of semiology that we saw while he was there, highlighting kind of what I'll talk